So in this first section regarding tumors of the stomach, we'll be studying about the different gastric tumors, and we'll be studying about the epidemiology and the causes of gastric tumors, such as the pathogenesis, what are the pathological events that occurs within the development of a gastric cancer, and what is the role of tumor genetics in the development of a gastric cancer. So if we talk about the epidemiology, there's a great variation within the different countries of the world, and the highest incidence of gastric cancer being in the Far East. Other than that, the gastric cancer is usually has a very decreased incidence in the Western countries, and it has been happening since the past century. And if we talk about the difference between male and female, it is the leading cause of cancer death, specifically in the males. And it is the 14th leading cause of cancer death, specifically if we talk about the United States. And lastly, in the US, the median age of diagnosis is around 70 years. So if we see the incidence of gastric cancer is usually decreasing in the Western countries, but the incidence is high if we talk about the Far East. So if we talk about the incidence around the world, as you can see, the least incidence of gastric cancer is around North America and the Canadian countries. Other than that, parts of the Africa also has a very low incidence, and including Australia has a low incidence of gastric cancer. And that if we talk about moderate incidence of gastric cancer, we can see some parts of the South America and then some parts of the European countries and Africa have a moderate incidence of gastric cancer, being less than 14.6 per rate per 100,000 individuals. And other than that, the highest incidence of gastric cancer is around the South America and countries involving Russia, China, and the Far East, where they have the rate per 100,000 individuals is almost touching 70. So if we talk about the gastric cancer incidence and mortality rate per 100,000 in between different racial groups and between male and female, specifically if you're talking about the United States of America, the incidence rate among all the races is around 10.5. If we talk more specifically about the male, because it is a cancer that is occurring more in males, the all races incidence is around 10.5, and the mortality is around half, which is 5. If we talk specifically about the white race, the incidence is around 9.3 in males, and the mortality is around 4.4. And if we talk specifically about the black, they have the most highest rate of incidence, which is around 17, which is almost double to the incidence of the white race, and the mortality is also double as 10.3 as compared to 4.4. Other than that, there are different racial aspects, such as the Asian have around 16.4, which is almost as blacks, and then Indian have around 13.6 incidence rate, and Hispanics have around 14.4. And if we talk about the mortality, Asian population have around 9 mortality rate, and American Indian having a little lower, 8.3, and the Hispanics having 7.3. So if we talk about risk factors, this table is going to be showing you the numerous dietary, environmental, and genetic factors, risk factors that are involved in the development of a gastric cancer. So if we talk about a more definite risk factors regarding gastric cancer, the first and the foremost being the Helicobacter pylori infection. The second being the chronic atrophic gastritis, intestinal metaplasia or dysplasia. Cigarette smoking is also one of the major risk factors of gastric cancer. Adenomatous gastric polyps, any history of gastric surgery, for example, the surgery of Billroth 2. And then different genetic factors such as family history of gastric cancer is very important. For example, in the first relative, such as being the father or the brother. Other than that, familial adenomatous polyps, more specifically about the fundic gland polyps, and then different polyposis such as the juvenile polyposis, Peutz-Jeghers syndrome, and hereditary non-polyposis of the colorectal cancer. So these are one of the definite risk factors regarding the development of the gastric cancer. So now if we talk about more probable risk factors predisposing to gastric cancer is high salt intake and obesity. Other than that, there is snuff, tobacco use, pernicious anemia, regular aspirin, and NSAIDs is a protective method for prevention of gastric cancer, and then the history of gastric ulcer. So lastly, being the possible risk factors, a lot of studies are going on to diagnose if these risk factors have a role in the development of gastric cancer. Statin use has a very protective role. Other than that, alcohol has a negative role on the development of gastric cancer. Low socioeconomic statuses, Meniere's disease, high intake of fresh fruits and vegetables is a protective method, and high ascorbate intake has a more positive role in the decline of the gastric cancer development. So if we talk about dividing gastric cancer into groups, the first being the intestinal type. Intestinal type has a character of being or of having a formation of gland-like tubular structures with features like intestinal glands. So this intestinal type of gastric cancer is usually declining these days. And if we talk about the second type, which is being the diffuse type, this sort of gastric cancer lacks any glandular structure as compared to the intestinal type and consists of poorly differentiated cells that infiltrate within the wall of stomach. This type of diffuse type of gastric cancer usually occurs at a younger age and has a very worse prognosis as compared to intestinal type. So now if we divide the gastric cancer primarily on the basis of location. So there is a proximal tumor and there is a more of a distal tumor. So if we talk about proximal tumor, what parts are included? The esophagogastric junction, which is also known as EGJ, and then the gastric cardia, and if we talk about the distal tumors, it's being divided into three parts, one being the fundal part of the stomach, and then the body of the stomach, and finally the antrum of the stomach. So if we see in this picture, how are the parts divided? So as esophagus joins the stomach at this point, which is called as the esophagogastric junction, and the beginning part of the stomach, the initiating part of the stomach, is also called as cardia. So this more globular part of the dome part of the stomach is called as the fundus. And then after the fundus is the body of the stomach, and lastly the part that connects to the small intestine is known as the antrum. So so gastric cancer is divided into two types, being the proximal part, which includes two such as the esophagogastric junction and the cardia, and then the more distal part, which is divided into three. So if we talk about Helicobacter pylori infection, it is more associated with proximal part of the tumors. So as there is a decline of Helicobacter pylori infection these days, so there is a decline of proximal tumor in this age. Other than that, as compared to proximal tumor, there is an increase in the distal tumors as compared to the proximal tumor. So if we talk about what are the causing factors of gastric carcinoma, so as there have been some histopathological studies going on, those indicate that there's a progress of events that occur that predisposes to the gastric cancer, such as being as there's a normal gastric mucosa. So if it's affected by Helicobacter pylori or different types of diets or salts, this causes superficial gastritis and chronic inflammation. So after this, step by step, things gets worse, and there's a stepwise progression to the gastric cancer, such as being the events such as chronic Helicobacter pylori infection predisposes to atrophic gastritis with the help of recruitment of bone marrow cells that form tumor microenvironment. And then secondly, it predisposes to metaplasia, which is more of a cancerous form. The causes are high gastric pH, bacterial overgrowth, and nitrate reduction, and any sort of barrier defect that causes metaplasia. And that then the next step is dysplasia, which is because of different types of salts or any carcinogens, and chronic inflammation that causes this changes within the epithelium. And lastly, it completely predisposes to cancer, which is gastric cancer. So if we talk about what are the factors that causes gastric cancer, first being, as Helicobacter pylori infection is worldwide known, and it causes infection within the stomach. And the second being different types of dietary factors that are harmful and predisposes to gastric cancer. Second being smoking. Smoking is very injurious and has carcinogenic effects. Third being alcohol intake. Fourth, obesity. Genetic factors. So lastly, there are different types of genetic factors that are involved in predisposing to the development of gastric cancer. So if we talk about Helicobacter pylori infection specifically, it is a worldwide known infection, and it infects almost around half of the population of the world, and is known as a primary etiological factor of gastric cancer. So what happens is that Helicobacter pylori infection occurs, and it predisposes to gastric cancer as a combination of the virulent bacterial strain with a genetically primitive host, which allows the infection to invade to the host cells. Thirdly, a very favorable gastric environment that helps colonization of the Helicobacter pylori infection. And lastly, these all three factors are necessary for the occurrence and for the development of a gastric cancer. So Helicobacter pylori infection, if we take a history of the Helicobacter pylori infection in a patient, it can lead to three possible outcomes. First being a simple gastritis that could occur. Second being a duodenal type of phenotype. And thirdly, a gastric ulcer or a gastric cancer type of phenotype. So if we talk more about Helicobacter pylori infection, the induction of chronic inflammation by Helicobacter pylori infection, which slowly predisposes to a chronic gastritis being the atrophic gastritis, and then to a more cancerous type being the intestinal metaplasia, dysplasia, and ultimately cancer. So gastric cancer usually occurs in the setting of a gastric atrophy or hypochlorhydria. So these gastric atrophy and hypochlorhydria predisposes to a more Helicobacter pylori prone environment, which causes the overgrowth of bacteria. And there are different types of genes that are recognized as risk factors, which are receptors that are present on the host cells, one being the CAG pathogenicity island, and the second being the vacuolating gene, which is the VAC-A and the BAB-A2 gene. So as in this picture, we can see that there's a normal stomach. After the stomach being infected by Helicobacter pylori infection, there is gastritis. And after this gastritis, there are different types of environmental factors that can predispose to a more cancerous type, being the stress, salty meals, any carcinogenic substances, and persistent infection being the chronic Helicobacter pylori infection, and ultimately either causes a gastric ulcer and duodenal type of ulcer, and lastly being the stomach cancer. So the other types of causing factors of Helicobacter pylori infection, first being the dietary factors. The use of refrigerator, fruits intake, fish causes a low risk of Helicobacter pylori infection, as the decreased temperature within the refrigerators and the fridge it causes a low production of bacteria, fungi, and the contaminants of the fresh food. And also it can also help in the usage of bacteria to overcome the production of nitrites, which causes gastric cancer, which is very carcinogenic. So high intake of nitrate and preserved foods and high salt intake are all the high risk factors regarding the dietary factors. Second, the smoking. Smoking had a almost 1.5 to 2-fold increased risk to predisposing to gastric cancer. Thirdly, studies have been going on, and there's not a very significant association between alcohol and gastric cancer, but there is a small risk of gastric cancer among individuals who take alcohol. And lastly, obesity, BMI around 35 or more is associated with almost 2 to 3-fold of increased risk of gastric cancer. So lastly, if we talk about tumor genetics, what are the role of tumor genetics in the development of gastric cancer? Genetic abnormalities in the gastric adenocarcinoma, as adenocarcinoma takes up almost the majority of the malignancy regarding stomach, and it is the most predisposing type of gastric cancer. So there are different types of genetics, such as the DNA aneuploidy. It is one of the most common genetic mutation that occurs around 50 to 60%. And then deletion and suppression of some genetic factors, such as the tumor suppressor gene P53. As tumor suppressor gene suppresses the tumor and the proliferation of cells, so any deletion or suppression or decrease function of tumor suppressor gene P53 causes mutations to occur and causes the extreme proliferation and the predisposing factors to gastric cancer. And then another gene, such as fragile histidine triad gene, it can also cause some mutations to occur within this gene, and the suppression of this gene causes the gastric cancer development. Other than that, there is the APC gene, which is the adenomatous polyposis coli gene, and the loss of heterozygosity. And then the third being the DCC, which is the deleted in colorectal cancer gene. So deletion and suppression of all these genes has a role in the development of gastric cancer. And that the decreased expression due to hypermethylation is P16 and P17 and P23. These are all the decreased expressions that can cause gastric cancer. Other than that, there is the TFF1, which is the human trefoil factor 1 gene, and then E-cadherin, and other than that, human mutation humalog 1 gene. So there's also an amplification and overexpression, which also has a role in the development of gastric cancer, such as the growth factors such as the COX-2, beta-cadherin, and the hepatocyte growth factors and the vascular endothelial growth factor, which has an overexpression and consists of more cell proliferation, which causes cancer. And lastly, the mutations within P3K, which is phosphatidyl inositol 3 kinase gene, and then the protein tyrosine phosphatase receptor type gene. The mutations within this gene can also predispose to the development of a gastric cancer. So in this section, we've studied about the epidemiology. What is the incidence between different countries worldwide? And then what are the etiological factors, and what are the pathological events that predisposes to gastric cancer? And lastly, we've studied about Helicobacter pylori infection again, which is ultimately the primary etiological factor of gastric cancer, and different types of dietary and alcohol and smoking factors, and lastly the tumor genetics that causes. So this is all from this section. Thank you for watching sqadia.com.